Go and stand in front of your bathroom mirror for a moment and look closely at the skin right underneath your eyes. Not the wrinkles, not the lashes, just that thin little half-moon of skin sitting below each eye. Is it darker than the rest of your face? Does it look puffy, swollen, almost as though you slept badly, even on the mornings when you slept just fine? Most people glance at those shadows and those bags, sigh, and blame it all on one thing: tiredness, just getting old. But after the age of 60, those dark circles and that puffiness are very often not about sleep at all. Sometimes they are your body quietly waving a small flag, trying to tell you something about what is happening on the inside. And today, I am going to show you how to read that flag. I am Dr. Daniel Mercer. For more than 18 years, I have worked in internal medicine, which simply means I am the kind of doctor who looks at the whole body and asks why. And I will tell you something I have learned in all those years. The face, and especially the area around the eyes, is one of the most honest windows into a person's health that we have. So if you have been staring at tired-looking eyes in the mirror and assuming there is nothing to be done, I want you to relax, sit back, and stay with me for the next few minutes. Because once you understand what those shadows and that swelling actually mean, you will know which ones are harmless and which ones are worth a quiet word with your doctor. Before we go any further, if you find that plain, honest health information like this is helpful to you, take just 1 second to like this video and to subscribe to the channel. It truly helps me reach more people over 60 who deserve straight answers about their own bodies, and it costs you nothing at all. Now let us look in the mirror together and understand what is really going on. Let me tell you about a patient of mine. I will call him George. George was 71, and he came to see me mostly because his wife had nagged him into it. His complaint was simple. For about a year, he said, his eyes had looked tired and puffy all the time, with dark rings underneath, and people kept telling him he looked exhausted even when he felt perfectly rested. He was almost embarrassed to bring it up, because it seemed like such a small, vain thing. But George had also been feeling a little more worn out than usual, and a little colder than everyone around him. When we looked into it together, his puffy eyes were not vanity at all. They were one of the first visible signs of an underactive thyroid, something we caught early and managed well. George later told me that the puffiness around his eyes may have been the thing that saved him a great deal of trouble down the road. That is exactly why I never wave these signs away. And by the end of this video, you will not wave them away either. So let us start with the skin itself, because to understand the eyes, you first have to understand how special and how fragile that little patch of skin truly is. The skin under your eyes is the thinnest skin anywhere on your entire body. In some places it is less than 0.5 millimeter thick. That is thinner than a sheet of paper. And underneath that delicate skin sits a network of tiny blood vessels packed close together. Now here is the part that matters as we age. With each passing decade, your skin naturally loses collagen and it loses fat. Collagen is the protein that keeps skin firm and plump like the stuffing inside a cushion. Fat is the soft padding underneath. As both of them thin out over the years, the skin under your eyes becomes even more see-through than it already was. Think of it like a lampshade. When the shade is thick, you barely notice the bulb behind it. But take a worn, thin shade, hold it up, and suddenly, the bulb glows right through. That is exactly what happens under your eyes. The dark, bluish-red blood vessels that were always there now show through the thinning skin, and we see them as dark circles. This is the single most common reason older adults develop dark circles, and I want you to hear this clearly. On its own, this kind of dark circle is completely harmless. It is simply the natural thinning of the skin that comes with the years. The American Academy of Ophthalmology describes this same process, the loosening and thinning of the skin and the weakening of the tissues around the eye, as a normal part of aging. So if your circles have come on slowly, over many years, evenly on both sides, with no other symptoms, that is very often just your skin telling its age, nothing more. Now let us talk about the puffiness, the bags, because they have their own story. Underneath your eyes, there is a thin sheet of tissue, almost like a little hammock, that holds a small cushion of fat in place against the eye. When you are young, that hammock is tight and strong, but over the years, just like everything else, it weakens and it sags. And when it sags, the fat that used to sit neatly behind it slips forward and bulges out into the lower lid. That is what creates the classic under-eye bag. It is the eye's own padding, drifting forward because the support behind it has loosened. Again, on its own, this is a normal part of aging, and it is harmless. But here is where it gets interesting, and here is why you cannot simply blame everything on age and walk away. That same thin, sagging tissue under your eyes is also the perfect place for fluid to collect. Because the skin there is so loose and so delicate, even a small amount of extra fluid in your body will pool right there first, before it shows up anywhere else. Your under-eye area is, in a sense, the lowest and softest spot on your face, a little catch basin, and that is why the eyes are so often the very first place that certain whole-body conditions reveal themselves. When your body is holding on to extra fluid, your eyes frequently swell before your hands or your ankles do. So let me walk you through the everyday harmless reasons your eyes might puff up, and then the handful of reasons that deserve a closer look. Let us start with the simple ones. The first is salt. If you ate a salty dinner last night, a bag of chips, a slice of pizza, a bowl of soup from a can, your body holds on to extra water to balance all that sodium. Your body likes to keep its salt and water in careful balance, almost like a recipe. When too much salt comes in, the only way to keep that balance right is to hold on to more water alongside it, and that borrowed water has to go somewhere. And where does it show up first thing in the morning? Right under your eyes, in that soft little catch basin we talked about. This kind of puffiness usually fades as the day goes on and you move around, because once you are upright and active, gravity and movement help drain that fluid away. The second simple reason is dehydration. It sounds backwards, but when you do not drink enough water, your body actually clings to the water it has, and your tissues can look more swollen, while the skin underneath looks dull and shadowed. As we age, our sense of thirst fades. So many older adults are quietly running low on water without ever feeling thirsty. The third reason is allergies. Hay fever, dust, pet dander, all of these release a substance in your body that makes the tiny vessels around your eyes leak fluid and swell, and it often comes with itching and redness. The fourth is sleep position. Lying flat all night lets fluid settle around the eyes, which is why the puffiness is worst when you first wake and slowly drains away once you are upright. And yes, the fifth is genuine poor sleep, which can make the vessels under the eyes dilate and the skin look more shadowed. So sleep does play a part. It is simply not the whole story. Now, those are the gentle, everyday reasons, and they cover most cases. But I am an internal medicine doctor, and my job is to make sure we do not miss the quieter signals hiding among the harmless ones. So let me tell you about the conditions where puffy eyes and dark circles can be an early clue, the ones worth bringing to your doctor. The first is the thyroid, the very thing we caught in George. Your thyroid is a small gland in your neck that sets the pace of your whole body. When it slows down, a condition called hypothyroidism, your body holds on to more salt and water, and that fluid often gathers around the eyes, giving the face a puffy, slightly swollen look. This becomes more common as we age, especially in women. If your puffy eyes come along with feeling cold when others are warm, dry skin, thinning hair, fatigue, or unexplained weight gain, that combination is worth a simple blood test with your doctor. The second is the kidneys. Your kidneys are the body's filters, quietly cleaning your blood and balancing your fluids every minute of the day. When they are not working as well as they should, fluid and salt build up in the body, and because the skin under the eyes is so loose, that is frequently where the swelling appears first. Doctors have a name for this puffiness around the eyes. Periorbital edema, and persistent swelling there, especially in the morning, is one of the classic early signs that the kidneys deserve a check. If your puffiness is steady, day after day, and does not drain away as the morning goes on, mention it to your doctor. The third is iron, specifically anemia, which means a low level of healthy red blood cells. Your red blood cells are the little delivery trucks that carry oxygen to every tissue in your body, including that thin skin under your eyes. When you are low on iron, there are simply fewer of those trucks on the road, and less oxygen reaches the skin. The skin loses some of its healthy color and turns pale, and against that pale background, the dark vessels underneath stand out even more, deepening the shadows you see. This is one reason a person with low iron can look as though they have not slept in a week, even when they have rested perfectly well. Anemia is common in older adults, and it often comes along with tiredness, weakness, a touch of breathlessness on the stairs, and looking unusually pale. A simple blood test can settle it, and the good news is that, once found, it is very often straightforward to put right. And the fourth, which ties many of these together, is fluid retention from the heart or from certain medications. When the heart is not pumping quite as strongly, or when a particular medicine causes the body to hold water, that extra fluid can show in the face and around the eyes. I am not telling you to fear your medications, and please, never stop or change any medicine on your own. I am simply telling you that if you notice new, lasting puffiness, it is a perfectly good reason to ask your doctor whether anything you take could be playing a part. So now you can see the picture clearly. Dark circles and puffy eyes are not one thing. They are a doorway. Most of the time, that doorway opens onto something completely harmless, thinning skin and the natural softening of age. But every so often, it opens onto an early signal: the thyroid, the kidneys, your iron, your fluid balance, and the eyes were simply the first place it showed. So how do you tell the difference? Let me give you a simple way to read your own mirror, the way I read it in my office. First, ask yourself how it came on. Dark circles and bags that crept in slowly over many years, evenly on both sides, with nothing else wrong, are almost always just aging. But puffiness that appeared more suddenly, or that has clearly worsened over weeks or a few months, deserves attention. Second, ask whether it drains away. Morning puffiness that fades as the day goes on is usually harmless fluid that simply settled overnight. Swelling that stays all day long, every day, is the kind to mention to your doctor. Third, and most important, ask what comes with it. Puffy eyes all alone are usually nothing. But puffy eyes plus feeling cold and tired, or plus pale skin and weakness, or plus swelling in your ankles, or plus shortness of breath, that combination is your body speaking in a fuller sentence. And that is when you pick up the phone and book a visit. Now let me give you the gentle, everyday things you can actually do at home for the harmless kind, because there is a lot you can do. The first and easiest is to raise the head of your bed, or simply add an extra pillow, so fluid does not pool around your eyes overnight. The second is to gently ease back on salt, especially in the evening, because that is what fuels the morning puffiness. The third is to drink enough water through the day, since, as we said, a dry body holds onto fluid and looks more shadowed. The fourth is a cool compress in the morning. A clean cloth dampened with cool water, or even the back of a chilled spoon, held gently against closed eyes for a few minutes, helps shrink the puffiness by calming those little vessels. And the fifth, if allergies are your trouble, is to talk with your doctor or pharmacist about a suitable allergy remedy, because calming the allergy calms the eyes. Here is one small habit that makes all of this stick, because knowing something and remembering to use it are two different things. Pick one fixed moment in your day, the moment you brush your teeth each morning, and let that be your check-in. While the brush is in your hand, take 3 seconds to glance at the skin under your eyes. You are not looking for perfection. You are simply learning what is normal for you, so that the day something changes, a new puffiness, a new shadow, a swelling that will not drain, you will notice it early, while it is still easy to act on. Your mirror becomes a quiet health check you already do every single morning, for free. And here is a small bonus that stacks right on top. When you do your morning cool compress, lie back for those few minutes with your head slightly raised and simply breathe slowly and rest. You let gravity help drain the fluid, you calm the vessels with the cool cloth, and you give yourself a small moment of genuine rest, all at once. It is a tiny ritual, but it gently addresses the puffiness from more than one direction at the same time. Now let me give you the honest safety word, because it matters. Everything I have described today is gentle and safe for nearly everyone. But please remember this: I cannot see your eyes through this screen, and I cannot run your blood tests. So if your puffiness is new and persistent, if it sits on one side far more than the other, if it comes with eye pain, redness, or changes in your vision, or if it arrives alongside swelling elsewhere, breathlessness, or that bone-deep fatigue, do not try to sort it out alone. Bring it to your own doctor. Periorbital swelling can occasionally be the first sign of something that needs proper care, and a simple visit can give you either a clear answer or a great deal of peace of mind. Either way, you win. So let me bring it all together for you. The dark circles and the puffy eyes you see in the mirror after 60 are very often not about sleep at all. Most of the time, they are the simple, harmless result of thinning skin and the softening of the tissues that comes with age. And for those, a little less salt, a little more water, a raised pillow, and a cool morning compress go a long way. But sometimes those tired-looking eyes are an early flag for your thyroid, your kidneys, your iron, or your fluid balance, and the clues are in how suddenly it came on, whether it drains away, and what other signs come along with it. You do not need to fear your own reflection. You simply need to learn how to read it. If this was helpful to you, and you would like more plain, honest explanations of what your body is trying to tell you, please subscribe and stay with us here. This channel exists to help you understand your own body and to stay strong, clear, and independent well past 60, and I would be honored to be a small part of that. Take good care of yourself, and I will see you in the next one. And one last important note. This video is for general educational purposes only, and it is not medical advice. Always speak with your own qualified healthcare provider before making any changes to your diet, your routine, or your medications, and have any new or lasting symptom properly checked. Your doctor knows your body, so bring these ideas to them and let them help you use them safely.